Cervical cancer rates in this country have plateaued, signaling that the country is moving in the wrong direction in terms of eliminating the disease. New data from the Canadian Cancer Society shows there has been no significant declines in rates of cervical cancer for the past 20 years. Canada has set a goal of eliminating the disease by 2040 as part of the World Health Organization's global strategy. The report warns, though, that Canada may not reach that target without more intervention. Jennifer Gillis is Senior Manager of Surveillance at the Canadian Cancer Society and joins me this morning. Good morning to you.
Good morning.
So this new report looked at more than 20 cancer types. What is the data highlighting specifically about cervical cancer?
Yeah, thank you for having me to be able to talk about this foundational report that's made available through our collaboration with Statistics Canada and the Public Health Agency of Canada. Because what stood out to me in the report is that 1,650 people are expected to be diagnosed with cervical cancer this year, and 430 lives will be lost to a disease that's preventable. And as you mentioned, what we're really seeing with the trends is that after a period of significant, considerable progress, cervical cancer incidence rates have plateaued, which really signals that we may be at risk of not meeting Canada's goal of eliminating cervical cancer by 2040.
So what is happening? Because we know cervical cancer rates were declining until 2005. What are the reasons for this leveling off, do you think, over the last 20 years?
Yeah, thank you. There's been a lot of variability in the rates in cervical cancer over the last 20 years. And again, we're seeing that plateauing of cervical cancer incidence rates after a period of significant progress. This is likely driven by many factors, including increased transmission of human papillomavirus, or HPV, as well as low uptake of the HPV vaccine, lower cervical screening rates, as well as gaps in follow-up care, which might all be contributing to what we're seeing in the variability, as well as the plateauing in cervical cancer incidence rates that have been highlighted in the report.
So Jennifer, what can we do?
Thank you for that question. It's not a question of can we eliminate cervical cancer? It's really, will we? But it will take all of us, including governments. And governments can do many different things. For instance, adopting HPV testing as a primary screening tool is a great way to help move us forward. And that's because the HPV test is more sensitive, it's easier to interpret, and it can actually be done at home when self-administered or self-sampling tests are offered to people, which can help increase participation in cervical screening. Also, reducing barriers to receiving the HPV vaccine. This could include, for instance, a once eligible, always eligible policy that would reduce or remove cost barriers for individuals who may have missed out on receiving the HPV vaccine as part of the school-based programs that are available across the country.
Any advice for somebody watching right now who's pretty concerned about their own risk?
Thank you for that question. I know it's top of mind for many of us. And so the Canadian Cancer Society does recommend that women and people with a cervix get cervical screening, starting at the age of 25 to 70. So you'll need a Pap test every 3 years, or for provinces and territories that are using the HPV test, you'll need an HPV test every 5 years. And for the HPV vaccine, we recommend children and adults from the ages of 9 to 45 be vaccinated against HPV to help reduce your risk for HPV-related cancers, including cervical cancer. So talk to a healthcare provider or call us at 1-888-939-3333 to learn more about what's available to you in your province or territory.
Jennifer Gillis, Senior Manager of Surveillance at the Canadian Cancer Society. Thank you.
Thank you.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.